Hello everyone, welcome to the class. My name is Bo Han, and I will be your instructor for this semester. In this lecture, I want to introduce a very exciting new field to everyone. It's healthcare informatics. We want to talk about what healthcare informatics is, and then we want to take an overview about the theoretical foundations of healthcare informatics. Because healthcare informatics is new, there hasn't been a uniform definition on this concept. In this class, we define healthcare informatics as a science that focuses on healthcare data collection, analysis, and knowledge sharing. The targeted audience of this subject would be those healthcare professionals like nurses and doctors. The reason we want to study healthcare informatics is that we want to analyze historical healthcare data in order to find new knowledge and help people to live healthy and live better. When people talk about healthcare, they usually immediately think about services they get from doctors and nurses. This is a very traditional view about healthcare. Actually, we can provide healthcare through informatics as well. You probably don't realize this, but we are benefiting from healthcare informatics almost every day. For example, before a pharmaceutical company starts selling a new drug, the informatics professionals will compare the patient who took the drug to the patients who didn't, in order to test if this is a working drug. Also, we want to know, when a patient takes this new drug, what issues a patient should pay attention to. These are valuable information to other patients after the company starts selling the new drug. If you want to lose weight like I do, you will probably go to the internet, look for some exercise tips. Why some articles recommend you to do more cardio rather than sitting up? Because the analysts from physical education and exercise science have already done the comparison and find out cardio can give you better weight loss results. These are all good examples of healthcare informatics. No matter what we do, in healthcare informatics, we want to analyze data in order to provide better knowledge to people to help them live healthy and live better. This is the goal of healthcare informatics. But healthcare informatics is a very broad field. We have nursing informatics, clinical informatics, and pharmacy informatics. We couldn't cover all the topics in one class, in one semester. So we have to focus on nursing informatics. Please remember that nursing informatics is just one field of healthcare informatics. We just use nursing informatics as an example to study the entire process of healthcare data collection and analysis. I want to clarify this point before we move forward for the rest of this semester. Now let's talk about nursing informatics. This is the focus of this class. As the name implies to everyone, nursing informatics consists of two theoretical foundations, nursing science and information science. Let's use the rest of this lecture to talk about these two theoretical foundations. What is nursing? Nursing is a science that focuses on the protection of a patient's wellness and the optimal use of the medical resources. Those resources could include medical equipment and human resources like nurses and doctors. An increasingly important field in nursing science is preventive care. For example, if an epidemic disease breaks out in Area A, we want to raise awareness of residents in Area B and provide preventive actions to them to avoid them falling ill. These are the goals of nursing science. To be excellent nurses, Students should focus on trainings in three aspects. The first one is the technical skill training. A nursing student should be able to manage medical resources and equipment, and perform appropriate procedures when they are needed. The second one is communication skill training. A nursing student should be able to effectively communicate with patients and deliver care information to the patient. The third one will be the cognitive skill training. A nursing student should have the ability to observe, recognize, and collect data, and use appropriate models to analyze the dataset. How to analyze the dataset will be the focuses of some courses in this semester. The second theoretical foundation is information science. This subject focuses on data collection, data analysis, and knowledge sharing. The goal of information science is to help people to make better decisions through data analysis. By the way, in information science, the terms information and knowledge are equivalent. In the future, if I mention information system, information sharing, they basically refer to knowledge system, knowledge sharing. They are the same concepts. This picture shows everyone the focuses of information science. On the top, we have KA, KD, KG, and KP. KA represents knowledge acquisition. Another term is data collection. KP represents knowledge processing. Another term is data analysis. KG represents knowledge generation. Basically, this is the finding from our analysis. KD represents knowledge dissemination. Another term for this is knowledge sharing. Once we get new findings, we need to share these findings with stakeholders like patients, colleagues, and the public. If you think about the two theoretical foundations, you can find that even if we don't have nursing informatics, information and knowledge are playing very important roles in nursing this profession. Nurses are basically knowledge workers, acquirers, and users. For example, to take care of a patient, a nurse needs to track down a patient's medical history. Take a look at the information such as what allergies this patient might have, what diet this patient have been having, and so on, in order to develop an effective care plan. Nurses are also knowledge engineers, managers, and developers. When nurses analyze patients' medical records, they do not simply use the models from information science. They also consider factors for the nursing profession, like the ethical issue, privacy issue, and cybersecurity management for the patient's medical records. Because nursing and information science have such a close relationship, we combined these two and developed the nursing informatics discipline. I hope after this introduction, everyone have a better view about the healthcare informatics, nursing informatics, and the theoretical foundations of this new discipline.